It's always an exciting time to have you join us on the program Healthy Living with yours sincerely, Oluije Oyihohai. Today on Healthy Living, we will be looking at heart disease, yes, heart failure, the causes, the treatment, and of course, prevention. And to do that with us is the person of Dr. Akinwumi Ojo. He is the consultant cardiologist, UBTH. Good afternoon, sir.
Good afternoon, Jay.
Okay, and we say a big thank you to you for taking out your time to be with us today in the studio. All right, so quickly now, we'll let you know that heart disease, including heart attack, is the leading cause of death globally, claiming an estimated 17.9 million lives each year. Yes, I had to make an emphasis on that. Each year, 17.9 million lives go down just because of heart disease, including heart attacks and the related causes. So today we'll be looking at, yes, heart attack. First off, Dr. Joe, we've been hearing heart attack. Some persons will say, oh, he died of heart attack. He died of heart attack. So we want to know, what is heart attack? What are the causes, the prevention? So we need to know more about heart attack today on Healthy Living. So first off, what is heart attack?
All right, thank you very much, EJ. When we say heart attack, is just the common term that we use, but the technical name is actually what we call myocardial infarction. Okay. Myocardial infarction is a big name. Let me just break it down. It means, the heart, which the primary purpose is to pump blood around the heart, also has blood vessels that supply itself. So before the heart pumps, it has to also stay alive. So there are blood vessels that supply the heart itself. We call them coronary arteries. So when these arteries are blocked, either due to thrombus from anywhere or due to disease of the vessel themselves, the parts of the heart that are supplied by this particular vessel will not get nutrients, will not get oxygen. And of course, what we expect that part of the heart would start to die. So that sudden onset cessation of blood supply to a particular part of the heart is what we call myocardial infarction, that people generally call heart attack.
Okay. All right, so they say, well, the overall number of deaths from cardiovascular disease, CVDs, is rising due to population growth and aging. Now, the age standardized death rate, which accounts for population changes, has been decreasing. Now, in 2019, CVDs accounted for 32% of all global deaths, which heart attack and stroke being the cause of 85% of these deaths. Now, like I did ask, how can we say population growth is another cause for heart attack?
All right, thank you very much. When we talk about prevalence of a particular disease condition, it's a function of the new onset of those diseases and also the population. Our population, we are growing, we tend to increase in number, people are giving birth, and as people are giving birth, all these risk factors for cardiovascular disease is also there. So that's why we see a rise in the incidence and prevalence of some of these cardiovascular diseases. And as we read out, when we talk about causes of death, causes of sudden death, cardiovascular disease is actually the commonest cause of death anywhere in the world and even in our own environment.
Okay, so what's the difference between heart attack and what we'll call a sudden stroke? Yes, when someone has heart attack and stroke.
All right, thank you. They look similar, just that it happens in different organs.
Okay.
So the vessel that I said carries oxygen and nutrient to the heart is called coronary artery.
Yeah.
So if such artery become blocked, person has myocardial infarction, that we say heart attack. Now also in the brain, we also have the cerebral arteries, cerebral vessels that also carry blood nutrient to the brain. So if they also get blocked, particularly, that person will have something that we call ischemic stroke. There's another type of stroke that we call hemorrhagic stroke, which is actually due to rupture of this vessel, this tiny blood vessel that supply the brain. When they rupture, the person have hemorrhagic stroke. So stroke in the brain can actually be ischemic due to blockage of blood vessels, or hemorrhagic due to rupture of such vessels.
Okay, so what's the difference between left side and right side heart failure?
All right, so the term left side, right side heart failure, we don't really use it commonly again, but it just mean that the heart has 4 chambers, the upper one and the lower one, the atrium and the ventricles on either side, left and right. So either of these chamber or either of these chambers can have issues. The left side is actually concerned with carrying blood and nutrient to all parts of the body, except the lungs, while the right side takes blood that are poor in oxygen from every part of the body and take it to the lungs to get oxygenated. So when someone has things like maybe leg swelling, abdominal swelling, the necks are palpitating, we say those are signs of right-sided heart failure. Whereas things like difficulty in breathing, shortness of breath, cough are signs of left-sided heart failure. So just a way of just differentiating what part of the body or circulation that is the part subserves.
Okay. All right. So right now we want to know the common factors that tends to result to heart failure.
All right. Thank you. Heart failure generally is also increasing, and in this part of the world, Nigeria, particularly Benin, even in our hospital there, hypertension is the commonest risk factor for heart failure.
Okay.
Most of our patients that have heart failure come as hypertension, and that's why we talked about when we pick, because before the heart fails, it gives a time. There's a time that the person is exposed to risk factor. There's a time that we start seeing some structural disease in the heart. So if we pick them up at the type of risk factor.
Like what are the commonest signs that one should watch out for, that the layman will say, oh, okay, this is what Dr. Ojo was actually talking about the other day. So we want to know, what are the commonest signs that we should look out for?
All right, thank you. The commonest and the earliest sign that someone with heart failure will have is shortness of breath, especially on exertion. The person will notice that possibly a market woman or someone that is very agile, that is to go about his normal day activity, will now start noticing that when he or she walk a little distance, he get tired, he get fatigued. Somebody that can maybe run down the stairs before on and up cannot even walk down, take 2 steps downward the stairs without getting fatigued on the road. You have to stop on the road and start to take fresh air before you start continuing. That's the commonest and the earliest sign that, oh, this heart have been struggling all this while, is now complaining. So that's the earliest sign. And other times you may start seeing that someone that is lying flat on a pillow or without a pillow before, we start noticing that you need 1 or 2 pillows to sleep. Some of them, even in advanced stage, cannot even sleep at all. They can't lie flat because they are autopney. Because by the time they lie flat, the fluid in the lungs, you start coughing, they start getting breathless. There is somebody who say, oh, since 2 days ago, I have not been able to sleep. I have been sitting up in the chair. Those are the things that heart failure usually cause.
Okay, so can diets, lifestyle, alcohol, smoking, can it trigger heart failure?
All right, thank you very much. You know, the other time I was talking about risk factors. So apart from hypertension, diabetic, lipids, alcohol and smoking are also confirmed risk factor for developing heart disease.
What about diets?
Yes, diet, also very important, especially diet that is deficient in vitamin like thiamine, like selenium, can have been shown to cause heart enlargement and heart failure. So that's why our diets have to be rich, have to be balanced, because if those vitamins are lacking in the diet, they can actually result into heart failure. Okay,
so how can people distinguish between regular fatigue and heart failure?
All right, so the regular fatigue, of course, everybody, if you do strenuous work to some extent, you get tired. But what we're saying is that you now notice that less than ordinary activity make you to be tired. Sometimes maybe just 2 steps or just standing up from your bed to your chair. Those are ordinary activities that people do on a daily basis.
Not to get
you don't need to get tired getting up from your bed to your chair. And you now notice that you are fatigued, you are having difficulty in breathing when you do those ordinary small activities. That would be a sign that the heart is under pressure and may need to be checked.
Okay, so can exercise and all of that help in checkmating all of this?
Yes, at the level of when the patient just has risk factor, hypertension, diabetic, this lipid that is high, exercise is very important. Even at the level of the heart failure, just that people that have heart failure, as I said, there's a limit to how much they can exert themselves. That's why it's after we've treated them, they're now better, that will now start them on what we call graded exercise. So exercise helps a lot, helps to reduce blood pressure, helps to reduce your blood sugar, helps to reduce your cholesterol level, and it helps a lot in managing heart failure.
Okay, now talking about diagnosis and treatment, are there surgical intervention for severe cases of heart failure?
Yes, thank you very much. There are different causes. So what will be the intervention will be a function of the etiology, the underlying cause of the heart failure. The heart failure of Mr. A different from Mr. B.
Okay.
As I've said, hypertension is the commonest cause. For some that is due to hypertension, by the time we treat the hypertension, treat the heart failure, they are better. But we know there are some other causes like valvular diseases. Somebody having maybe a valvular regurgitation or a stenosis that is resulting in heart failure. Those set of people, in severe cases, after we have tried medical treatment and not getting better, will need to actually have surgery in order to be able to solve the problem completely.
Okay. All right. Now, another thing that struck my mind, now there are some persons that they will complain and say, okay, at the right side of the heart, right, the left side, now there's this striking sign, I guess. Is that related to heart attack, heart failure?
All right. So the sign that you will get before it progresses to frank heart failure, as I said, most of the time there are warning signs.
Yeah.
Sometimes for some people it's palpitation, just maybe abnormal heartbeat. That may be just a warning sign for some people. And if it's checked at that point, you do your ECG, you do
And
your echo.
and you see that your temperature is
Yeah,
fine.
yes, and doctor is able to give you something to control at that level, then you'll be fine. So before it now progresses to the stage where you cannot even do anything for yourself again.
So the strike on the left side of the heart, is it normal?
Yeah, the strike, you mean like a pain on
And
the
like
left
a
side?
pain, like, you know, like a stretch.
Yes, yes. We know that not every chest discomfort is cardiac. It's due to heart condition. We should know that. But we know that for someone that has risk factors, someone that is hypertensive, someone that is diabetic, has dyslipidemia, and any sign you see in your chest, at least it's better to check first to be sure that it's not from the heart. So when your doctor has not reassured you that, oh, this sign you're having or this symptom you're having is not from the heart, you can now start looking elsewhere for such signs.
Okay. All right, in case you just joined us, we're looking at heart failure, the causes, prevention, and possible treatment. We'll be right back after this break. Just stay. All right, many thanks for rejoining us on the program Healthy Living, and we're looking at heart failure, the causes, prevention, and possible treatment. And we still have with us the person of Dr. Uju Akiwumi. He is a cardiologist, UBTH, the hospital. All right, now quickly, let's look at prevention. How can it be prevented?
All right, that's a very good one, and I will talk on prevention at different levels, talking about primary prevention and secondary prevention. Before I forget, let me quickly mention that for our pregnant women or people that are still nursing babies, we actually advise them to deliver their babies in good hospital where these babies can be checked up. Sometimes when you check them up, you're able to pick
The
some
heart rates,
holes in the heart. And some of those holes in the heart, if they are left unattended and they develop to adulthood, will actually cause problem in adulthood. And some of you are seeing them, people that are having holes in their heart, and we know that this cancer would have been there since birth, but it has not been attended to. Sometimes they come so late that there's nothing we can do for such kind of patient. We just have to do palliative care and things like that. So I need to mention that people should deliver where their children, their kids can be checked so that if they have holes in their heart, it can actually be corrected on time before it becomes other issue. Then, talking about primary prevention, people that are hypertensive, diabetic, has dyslipidemia, this set of people, we have to control the blood pressure. We have to control the diabetes. We have to control the cholesterol. By the time we control it, that is at primary level, so that structural changes in the heart as a result of those problems will not even happen in the first place. So by the time we control that, then for people that are already having some structural changes in their heart is enlarged, because I told you have heart enlargement, maybe someone that has heart attack before and you have heart attack survival, we should actually take medications. Because for those people, they are already on medication, so take your medication, let your blood pressure be controlled, go to for your clinic so that this will not progress to frank heart failure. We also want to advocate for provision of what we call cardiac catheterization laboratory, where people that have heart attack can have the vessel that is blocked, the permanent solution is to open up that vessel. So such provision is actually important in order to salvage that heart and to prevent that myocardial infarction, that scar, from progressing. By the time you're able to intervene on time and you open all the vessel, the heart is fine, and that person will not actually present with chronic heart failure.
Okay. Yeah. Okay, so can regular exercise help in checkmating all of this?
Yes, very important. Exercise is very important. We need to avoid sedentary lifestyle. We have to do exercise. Usually advocate 30 minutes of exercise, at least 5 to 7 days a week. Okay. That is 150 minutes per week. We have to stop alcohol. We have to stop smoking. We have to reduce salt in our diet. We have to exercise. Those are the ways to actually let the heart live, let the heart feel fine, control blood pressure, control cholesterol, control diabetes. So those are the ways to prevent heart failure.
Okay, looking at checkups, screening, how many times, let's say in a year, should one go to the hospital to do checkups?
All right, so for people that are asymptomatic, you don't have any signs, you don't have any symptoms, you're fine, you just want to check your heart, you can come. The Center for Disease Control in UBTH have what we call wellness clinic, in which people come, they check your blood pressure, take your sugar, check your, so if they are elevated, they refer you to where you can get treatment. If they are normal, you go back home. It's something you can, especially if you are more than 40 years, you can do every year. You come for your checks, they say you are fine, they tell you about your normal lifestyle changes, you go about with these old lifestyle changes, and you're fine. But every year you can come. For people that have hypertension, diabetes, dyslipidemia, you'll be under a doctor, the doctor will give you medication, give you time for checkup, you come for your checkup, you make sure that your blood pressure is checked at home and is controlled. So by so doing, you are preventing any heart structural problem with the heart as a result of this hypertension.
Okay, so now earlier on we did say as high as 17.9 million people lives each year, yes, go down with heart attack. Now, are we saying that it's increasing as the year goes by, or it's decreasing?
Oh, thank you very much. It's actually increasing. It's actually increasing. In the study I did recently in UBTH, we compare with what happened about 10, 20, 30 years ago. We see that the prevalence or incidence of heart attack is actually increasing. And it's not surprising. It's a result of increase in level of risk factor, hypertension, diabetes, dyslipidemia, and also we're also we're also checking more. We have more things to check. So we are seeing now that we actually have increase in prevalence of heart attack. Something that before we say is very rare in our environment. We don't really see it, but we see now from experience that it's actually increasing.
So what would we say is the actual cause of all of this? So years back, there was a decline, and all of a sudden there's an increase. You've talked about hypertension. Yes, we know quite all right. But apart from that, I was saying maybe forefathers or those, you know, had a better lifestyle than we did.
Well, it's multiple factors. Looking at it, multiple factors. One, the first thing is our population is increasing. Our population those years is not the same as so it's increasing. So increase in population, of course. When we have this condition like this, we also expect an increase. So that's one. And two, as I said, our investigation, our modalities of diagnosing this condition has also improved over the years. So that will also determines that we also have an increase in the prevalence. Also our lifestyle. Our lifestyle, before our forefathers more of agrarian type of lifestyle, but now we depend more on westernized food, you know, burger, westernized food, and because of that, obesity is increasing, dyslipidemia is increasing, hypertension is increasing. So our lifestyle is also a factor to play in the high increase in prevalence of this disease condition.
Okay, so in all of this, what role does public education play in preventing heart failure?
Thank you. So the role of public education cannot be overemphasized, and that's what we are doing presently, educating our people about the importance of a good lifestyle.
Are there seminars going around to talk about all of this?
Yes, seminars. You know, we are living in a digitalized age on social media. Even we have conferences that we do press conference during our conference as cardiologists, in which we educate people on the prevalence and increase in prevalence of cardiovascular disease in our environment, and what we can do as individuals to actually stem the tide.
Okay. What about support group? Are there support group that's around, to help patients in this the heart condition?
Yes, we have some support groups that can help patients with education. In the hospital, we do education, sensitization. So we have support groups, and we even have people that even companies that even can help people with their medications, how to adjust their medication, how to make sure that the medication is actually available, so that we're able to avoid some of these problems we are talking about.
Okay. Heart failure,
Yes.
causes, prevention, treatment. So in all of this, what's your advice as a person, a doctor in this particular field, a cardiologist? So what's your advice to those persons that haven't come down with, they're living a healthy lifestyle? So what's your advice? And for those persons that already have this issue with them, okay, what's your advice for them also?
All right, thank you very much. My advice is that the heart is a special organ. Start beating from when we are in the womb for around 21 days, and you continue to beat until, so for you to be alive, your heart has to beat, and just one organ. So let's take care of our hearts. Let's continue to take care of our heart, to continue that it beats and continue to beat. For those one that doesn't have any problems, we want to advise to live your normal life, avoid alcohol, avoid smoking, take food rich in vegetables, so that you won't come down with blood pressure in the first place. For people that have not known their numbers, we advise to come to the hospital. We don't wait until something happens. Come and check your blood pressure, because it doesn't give any sign. It's very silent. Check so that we can discover that there's hypertension. Now, by the time you discover that it's not a death sentence. They give you medications, live your normal life, no problem. For people that have one issue with their heart or the other, please, let's take our medications. Let's come for checkups. Let's follow the advice of our doctors, and by so doing, we'll be protecting the heart.
Okay. Before we go, is it hereditary?
Yes. Thank you very much. There are some heart conditions that are hereditary. That is, if you have family, the father or mother or sibling or brother that have some particular heart conditions, it can actually run in family. For example, there's a heart condition that we call hypertrophic cardiomyopathy. Cardiomyopathy is a disease of the heart muscle in which the heart just gets enlarged unnecessarily, not due to any factor. So that can actually happen in the family, run in the family. So we usually advise, when we pick that up in the hospital, we usually advise that the siblings of such individual should actually come for checkup, because they can actually come run in family.
Okay. All right, thank you so much, Dr. Ojo Akiwumi, for taking out time to be with us to expatiate on all of this as regards heart failure, the causes, treatments, and prevention. Now, someone is hospitalized for heart disease every 80 seconds. Dr. Ojo, am I correct?
Yes, it's a correct figure. Even we come to our hospital there almost every day, not almost every day, we have people coming down with one heart condition or the other. And sometimes they come early for some people don't come early. Some people have gone to many places before they now eventually come to the teaching hospital. So, and those are the issues that actually happens most of the time, that sometimes when they come at the time that absolutely too much can be done, it's actually a very serious problem. So that's why we talked about people be able to check themselves, and when they have problems, be able to come to the right place.
Okay. All right, so in all of this, you should know that we should take our health very, very serious. So take good care of your health, take good care of yourself, and always make sure you go for a checkup. We are not used to these things in Nigeria, Africa. So we need to do well to, go for checkups and check our system, check what's actually happening inside of us. Till we'll be seeing again next week for another exciting time on Healthy Living. I remain yours sincerely, Oluije Oyikokai. Do have yourself a blessed day. Bye for now.